Welcome, folks. Today we are discussing a fascinating 3-year follow-up study on pelvic ring fractures and their association with erectile dysfunction. This research, published in a reputable journal, delves into the long-term effects of different types of pelvic fractures on men's health and quality of life.
I see. So what were the main goals of this study? What were they trying to find out?
Primarily, the researchers wanted to assess the quality of life, QOL, in men at least 3 years post-pelvic ring fracture. QOL was measured using the SF-12 questionnaire. Equally important, they aimed to determine the rate of erectile dysfunction, ED, in this same group and investigate any links between the type of fracture and the development of ED. They hypothesized that pelvic ring fractures, in general, wouldn't be associated with ED, but their findings challenged that.
Interesting. How did they go about collecting their data? What was their methodology?
They used a cross-sectional study design, contacting male patients who had suffered pelvic ring fractures between 2016 and 2020. The patients were sent questionnaires, including the SF-12 for QOL and the IEF-5 for assessing ED. Returning the questionnaire was considered consent. They classified the fractures using the Young and Burgess classification system, categorizing them into Anterior-Posterior Compression, APC, Lateral Compression, LC, Combined Mechanism and Vertical Shear, CMVS, and a control group with no fractures. The IEF-5 scores were then categorized into levels of ED severity.
And what were the key findings? Did they find a correlation between fracture type and ED?
Yes, they did. They found a strong association between APC-type pelvic ring fractures and ED. In fact, all patients with APC fractures had at least mild ED. The study also showed that CMVS fractures were associated with significantly lower QOL scores, particularly in physical role function. Other risk factors for ED, such as hypertension, diabetes, and smoking, were also identified, but the APC fracture stood out as an independent risk factor.
That's quite significant. What might explain this link between APC fractures and ED? The study offers any hypotheses?
The researchers suggest several possibilities. The trauma energy in APC injuries might damage soft tissues in the anterior pelvic region, potentially disrupting blood vessels and nerves crucial for erectile function. Injury to the pudendal artery or nerve, for example, could be a contributing factor. They also mention that damage to the urinary tract, a common complication of pelvic fractures, is another potential risk factor for ED. It's likely a complex interplay of factors.
So, what are the implications of these findings for clinical practice? What should doctors be doing differently?
The study strongly suggests that early screening for ED should be incorporated into the management of patients with APC pelvic fractures. This could involve regular monitoring and potentially early intervention strategies to mitigate the risk of long-term ED. The study highlights the importance of considering the potential for ED as a significant long-term consequence of this specific type of pelvic fracture.
Were there any limitations to the study that you think are important to mention?
Yes, of course. It was a cross-sectional study at a single center, so the results might not be generalizable to all populations. Also, the data relied on self-reported questionnaires, which introduces the possibility of bias. And a significant number of patients didn't respond to the questionnaire, which could affect the results. The researchers acknowledged these limitations, and it's important to keep them in mind when interpreting the findings.
That's a good point. So, in summary, this study provides compelling evidence for a link between APC pelvic fractures and ED, highlighting the need for proactive management of this complication. Thank you for explaining this important research.
You're welcome. And thank you to our listeners for joining us today. We hope this discussion has been informative and insightful. Until next time,